So, dear Mr. Commissioner, dear ladies and gentlemen, dear colleagues, I'm the last speaker on the end of a long day, so you're tired, you're waiting for the ceremony. I try to be relatively concise and short in my presentation. So, first off, I would like to set the scene, and setting the scene in this case means I would do some basic clarifications. Part of my presentation will be to put some reality, what we heard before, into the process again. The first thing is the way forward. That is, to be very honest, a very fuzzy title. When I saw it first, I thought, well, it's perfect. I can say everything about that. It's not a problem. Then I went through the program and thought, well, the way forward is something like management, government of these ERNs. That has been covered already in the first. So it is something about, for instance, how to develop this IT platform. That has been covered in the second part. It could be something like how to integrate this into the healthcare, national healthcare system. We had this brilliant double conference from Paul and Nora, so that is covered as well. So my idea was, what could be the way forward from the viewpoint of a member state, and I decided to do it the other way around. I thought about what are the strategic goals, what could I pick up, what we should have achieved in 5 years, and that is what we now have to achieve in this way forward. The second thing I would like to clarificate is the member state perspective. Who, please, is the member state? That is different in all the 28 countries we represent. So it could be, for instance, the national or regional health authority, but it also is the payers, for instance. That could be, again, the national authority, but it could be something like a decentralized system which has health insurance funds, the federal states, and so on. And I come from a country where it is as complex like that. So we have three really very important actors in this field, which is the Ministry of Health, which are the federal states, and which are the insurance funds. So and that makes a lot of problems, I will show you. But in general, and we should never forget that, ultimately, the general public is the member state, because we are not institutions that are silos as well. We work for the people in our country. So that is what we have to keep in mind. And the third thing is we now have... Come on. Doesn't like me anymore? Okay. So we are now having the ERN ceremony. We have heard about, we come from the theoretical steps to the practical ones, but we should keep in mind, please, ERNs are not final yet. We are still in what I would like to call the work-in-progress mode. That is very important, what I want to tell you now. So coming to the strategic goals, I picked up 3. And you will be surprised that there is something you asked all the time here, so member states are thinking about that. So what I think is a very important goal is to find somehow approaching a kind of ideal network composition and format. The second thing is providing evidence for the success. That will be very, very important in 5 years to have that. And the thing is solving reimbursement issues we have been talking about already. So if I start with the network composition and format, you know the current situation, 24 networks, more than 950 healthcare providers, so that's really a big success. But it comes at an expense, because we have 26 different endorsement strategies in the member states. We have 26 different strategies how to identify the national healthcare provider. They are not equal between each other. We have a very broad range between the number of full members per network. Look at that. We have between 2 and 187. Now you could say, okay, that the higher number could be Germany, for instance, and the other one is a country with 800,000 inhabitants. Then it is a factor of almost 100 in between. That would fit. No, these are two countries which are, regarding their population size, separated by a factor of 4 to 5. And you see something is different here, and it is not really in a balance. And we have 3 member states which have no full member at all at the moment. We also have a relatively broad range of the number of full members per network. We have seen the numbers before, so it ranges from 18 to 73. And this all causes challenges. So one challenge is we don't have really, we like to want to work together. We have these common criteria, but it's not a final, really harmonized approach in setting up what is the network, what are really the centers. We have the disbalance somehow how member states are represented, and how do we deal with that? We have this lack of inclusivity if you look for 2 members only in a network. That's not enough, of course. And we might have a challenge with the size of a network. When we discussed all that in the board and in these expert groups before, we never thought of having 950 participating centers. We have never thought about 24 networks. We thought, well, it might be 12 and 8 to 10 are really mature that we can take them, and hopefully they will go over the threshold of 10 10 centers. You have to believe that. I mean, we were not so sure, because what I should say here is it was clear from the beginning. We said we will not give money in the beginning. So who would be interested to participate here? So therefore we had a little bit a different concept, and now we have this really broad range. Therefore we wanted to bring them together, and now we have networks with 73, and we have to look how that works. So that means, what are our objectives and tasks? If I look forward now for 5 years, the first thing I would like to address is inclusivity. We have to change something there, and you have heard there are 2 basic strategies for that. First off, and that has been said, I think, already, otherwise I disclosed this, we probably will have relatively soon, and that means by the end of the year, a next call for full members of existing networks. Not a call for new networks, but a call for new full members. That will probably range a little bit longer, until the mid of next year, but the process will be faster than was anticipated before in the board, but we decided we will probably be faster here. The other thing is that for those networks where member states don't have a full member, we want to give possibilities to find different approaches to link healthcare providers to the networks. This is called the Associated National Centers and the Coordination Hubs. I can't go into detail now, but there is a strategic paper prepared by the board that is almost finished, I have to say. We have just a few lines to change, and that will be published really very soon, but we can discuss on that if we have time in the discussion. The development of a more harmonized approach in the member states regarding the identification designation of HBCs. Maybe there we need to rethink a little bit strategically on the level of the member states what is really the center, the full member we want to have, and to somehow shape this by the time with what we have to develop anyway now, which is the elaboration of an evaluation process for ERNs, and therefore we just set up a working group for monitoring and evaluation, and we had discussions on a first relatively concise concept already, and this will be put forward relatively fast as well, so that optimistically probably we have first results in June. Final results will take longer because it's a roadmap with different steps, different work packages, you know that, and that takes longer, of course. Then, the relation of size and operation of the networks. We have to really critically review now whether the idea we had, having these thematic areas to trying to cover all the patients, still work when we have 73 network participating members, or whether this will cause some problems. And if it causes problems, then we have to rethink the story as well. Maybe the number of full members is then too high for a network. Maybe we should redefine then a little bit thematic areas. Maybe we have to see that their governance structure needs somehow an overarching umbrella and then sub-umbrellas which are also supported in their coordination, something like that. I don't know. We don't know the results at the moment, but then we have to be flexible to see how we can support that. So, reduced to one common denominator. In 5 years, I expect a further shaping and refining of the networks, and that is clearly a goal to bring them forward. The next point is success of the ERN concept. So success will be measured relatively clearly by the objectives which are laid down in the Cross-Border Healthcare Directive, and you have cited, when you made your network applications, at least some of them. Here you see an excerpt list. I don't want to go to the details. I highlighted 3, which I think is really very important. It is the improvement in diagnosis, the delivery of high-quality, accessible, cost-effective healthcare. Another one is the mobility of expertise, virtually or physically. Another one is, and that is, we have heard, 22 member states, right, Jan, are the same like Germany and France? Okay, good. I packed it. So one thing is help member states provide highly specialized services if they are not able on their own feet. That is really very important. That is something which gives the added European value. That will be something we want to see when we evaluate that in 5 years. So what will we have to do there? Objective and task for this is, as I said already, this is somehow linked a little bit, the development of an evaluation and monitoring process for ERNs and for the participating full members. This is required from the legal documents. So in the implementing decision, it's already laid down that the Commission has to do something. The Commission tries to shift some of the work now to the Board of Member States, and so we will actively support that. We will participate in that. And we also have the idea, and that is probably good news for you, that we would like to involve you in a way. We don't have discussed in detail how we do that, but we would like to have at least a selection of coordinators participating here, that we do not finally decide on evaluation criteria that completely are out of the scope of your networks and do not fit, because then it doesn't work as well. And then be aware, in 5 years you will have an evaluation of the networks by full members according to the legislation by an independent evaluation body. So that is another goal, and there we have to show what happens. And that is my second take-home message or common denominator. Improvements related to the objectives of the given ERN provide the best evidence for the success of the concept. I come to the third point, which is most critically, and if you are a member state representative, it's very difficult. I should say I'm a medical doctor and I'm just working for the health ministry, so take my notes a bit like that. So the current situation is, and that has been mentioned here several times, but as I say, member states are aware of that. It's not new to us. In principle, measures are in place to provide reimbursement for physical cross-border healthcare, and we have two instruments for that. There is the regulation number 883 from 2004, and that is the directive for cross-border healthcare. Yes, we know we don't have any measures in place to provide virtual cross-border healthcare. But when I reflect what I learned from the discussion in the last roundtable, is you somehow follow the strategy. I mean, I'm overemphasizing now, but please, board of the member states, sit together, think of a solution, provide a solution in 2 weeks. In 4 weeks we have it, and then it goes, and we are all fine. This will never work. It's a very, very long and tedious process to do the things, and this is proof of principle that even if we have measures in place, like for physical healthcare, I can tell you from the Austrian perspective that these provisions do not flow smoothly all the time, and we know that. So in certain relations it works better, in others not, and sometimes we have already healthcare providers who are really very, very reluctant to accept patients from abroad because they had problems getting any kind of reimbursement. That gives a financial disbalance which can be really tragic. And now I can refer to what the Maltese health minister said in the morning. So it's a little bit a hermeneutic cycle, because he said that is not a good process. You have to be careful that you not overload those countries which can provide support and highly specialized healthcare and accept patients. We have to find a way that this is reimbursed. And following this, you can understand that with the virtual cross-border healthcare it is probably more difficult, because there we don't have provisions at the moment at all. But in 5 years, objectives and tasks, somehow we have to find, and that is really a member state task, to abide to the rules we decided on. And that means we really have to find the method that it is a clear concept that physical cross-border healthcare is reimbursed from the member state of the affiliation of the patient to the member state of treatment. For the development of a reimbursement scheme for virtual cross-border healthcare, these are uncharted waters, or to cite the German chancellor. I'm a German, I should say, also, although I represent Austria, and this is the nice wording of Neuland, and so this is really Neuland also for the European Union. We don't have anything like that. That makes the story really complex. And what we need for this, to my point of view, is we need really a tough cost analysis. You cannot just say, we sit together and we do that. We have to know what is the price in an average across the networks, that we then can find some kind of reimbursement formula. We are not just at the beginning. We have pilot networks that have collected experience, and we have had a project run by the European Commission which was services, cost of services for ERNs. We are still waiting for the last report. We will see. It should somehow be covered. Whether it is sufficiently covered, I cannot tell you. I haven't seen any data from that. But we have something to build on. But we have first to do that before then, and this is a far higher level than the Board of Member States. Please don't overload us. We are not in the competence to decide on a reimbursement. That has to be brought to a completely different level than to decide how we can do this with a virtual reimbursement. My take-home message here is we want to take care on that, because that is for us a very, very important funding instrument to keep the networks sustainable. So the take-home, based on this, then we explore this. You have heard that, okay. So my take-home message here is the relation between costs, reimbursement, and the improvement of healthcare. Because if it's really something which is very important, and you see you have the benefit in the member state, you will take costs and you will make reimbursement. But this relation, if this is provided, that is crucial for payers when judging about further the success and the further support of ERNs. And in 5 years, we have the evaluation. So there we have to see. And as I told you, Austria is a state where the federal states and the payers from the health insurance companies are part of our designation process for centers. So they want to see in 5 years that this is something they not just invest money and it doesn't have any kind of success. So summary, I gave you a setting of the scene, which was the clarification of the title, what is a member state, and so on. I picked out these 3 strategic goals, which should be achieved in 5 years: the ideal network composition, the success for the ERN concept, what evidence can we provide, the reimbursement challenges, and I gave you these common denominators for each goal and potential impact on the continuous support of the ERN concept. And before I come to the end, I know we have heard a lot about newborns here, and 24 of them are now awarded. There's another baby which was born today. We received the message, when was it, Anna? About 1:30 or something like that. And thanks to the colleagues over there with the presentation, I can show you. Keep in mind, it's a common journey. Sorry, I've missed that. So this is not, it's our common task. Part of what I presented to you is, of course, something we expect from you as healthcare providers and networks, but a lot of that, and although I'm member state representative, I have to say this is also our homework we have to do ourselves. So see this in the positive way that we share the majority of tasks here, and of course we all want to be in a position to later say we have participated in the success of this concept. So and now I come to the other baby which was born today, because there is a new website for Orphanet. It's now a completely fresh look. It's more, let's say, Facebook-like probably, and more user-friendly in many, many aspects. I cannot give you far more details because the expert is over there, Anna Rath, so you can contact her. But it's very important, and I'm sure you probably more or less all are familiar with its network. I'm linked to that because I'm also country coordinator for Orphanet in Austria, and that was our important message here. And now I thank you for your attention, and yeah, that's it.